Welcome back, everyone. Well, we're always trying to look at ways to try and reverse or reduce our diabetes that most of us, how many people get it actually?
Well, right now, I think it's just over 26 million people.
26 million in America. So what do we do about it? We're going to have this new technique that Dr. Gordon is with us from Corner Canyon. How are you?
Good. How are you doing, Troy?
All right. What is the new effective approach? What is it about?
Well, see, the problem is right now in this country with the drug therapy model of treatment is people get diagnosed with diabetes and then they're told to lose weight, exercise, and then they're given medications. And it's not uncommon for us to see someone with diabetes to be on 2 or 3 different oral medications, to be on blood pressure medication, insulin treatment, cholesterol medication, and it's scary for the patient because they're starting to get into a position where they're seeing other people to deteriorate because of the complications of diabetes, which is like heart disease, stroke, amputation, kidney failure, blindness.
It's a pretty scary disease, isn't it?
And the sad thing is that they think that this is how it has to be, and it doesn't have to be that way.
So how do we approach it? What are you doing to reverse that?
So in our office, we take, it's a very specific treatment that we do as far as we are looking at customizing treatment plans for every patient, because although they've been labeled with this label of being a diabetic, not every person has diabetes for the same reason. So we need to find out specifically why they have that problem, why their body's not functioning the way it's supposed to. And when we can reverse that, when we can start to allow their body to handle the blood sugar, get their body working the way it's supposed to, we're able to reverse their diabetes and get them on track. So our approach basically is customizing treatment plans for the patient and doing extensive, thorough testing to truly find out why they have diabetes.
And what's involved in that testing?
It's cutting edge, state-of-the-art testing that we do that a lot of times they're prescribing physicians, they just test 1 or 2 things. Where we like to go through and do a very extensive blood panel. We do saliva testing, sometimes stool sampling is needed. And so it's customizing a specific plan for the patient, finding out exactly what is wrong with that patient.
And when you stick to these plans, it is proven that you do get results from it.
Yeah, we see patients, their blood sugar levels stabilize and they get reduced. A lot of times their insulin levels are decreased, and sometimes, a lot of times we can get people off medication. They lose weight without exercising, and basically they get their life back.
I think that's a huge plus, not just in reducing the effects of diabetes, but weight loss and also getting, like you said, getting your life back. It must be a huge issue for their families and as well as an expense being a diabetic as well.
Well, yeah, because of all the medications and things. And one of the big things for the patients that are diabetic is they're not given any hope. They're told that this is the best we can do. It's just a manageable disease. We'll just take these medications. And usually diabetics get worse over time. And so we want to make sure that we can reverse that. And so a lot of them, they're very motivated. If they just knew what they needed to do to reverse that, they would totally do it. But
and you're guiding them along the way the whole time, aren't you?
Exactly, yeah, like everything's customized for them.
Okay, so everyone has a different type of treatment plan, but they need to be analyzed by you before you can just say, oh yes, do this.
Yeah, we have a very specific qualification, plan in our office. We don't just take any patient. One of the main things, the first thing we look at is, do we think that we can actually help the patient? That's first and foremost. And then second, they have to be motivated because they have to make changes. And like I said, people that are motivated, when we find they're able to reverse that. They're able to have those results. They get better. Patients that are not motivated, they're usually not a good fit for our practice.
Well, I agree. You've got to be all in or not to actually have a healthier life. We've got a great offer also, which we're going to put up on the screen now. The first 20 callers to actually ring 801-553-9691 will get 2 consultations valued at over $490. Go to our webpage at abc4utah.com/GTU and we will link you to all the information. Dr. Gordon, thank you so much for bringing to our viewers as well ways to help them with their diabetes. We really appreciate that.
No problem, Troy.
Hey, Glenn, back to you.
All right, hey, coming up next, this is not your grandmother's wall.